Welcome everyone. My name is Briar Allison. I'm the Deputy Clerk here for the County of Brant. Just wanted to welcome everyone to the Paramedics Services Committee meeting of January 22nd, 2025. As this is our first meeting of the year, attendance has been taken and I'm going to proceed with the election of Chair and Vice Chair. That said, are there any nominations for the role of Chair? Councillor Martin? Councillor Miller, do you accept?
Yes, I do.
A seconder? Mayor Bailey? Do we have any other nominations?
Move to close.
Thank you. I will call the question to appoint Councillor Miller as the chair and close nominations. All those in favor? Approved. Thank you. And moving on to vice chair, are there any nominations? Councillor Miller.
I'd like to nominate Councillor Greg Martin.
Councillor Martin, do you accept? Seconder? Councillor Pierce. And are there any other nominations? Councillor Miller.
I'll move that nominations be closed.
Thank you. So I'm going to call the question to appoint Councillor Martin as the vice chair and close nominations. All those in favor? Thank you. That is approved. And I will invite Councillor Miller up to the head of the horseshoe.
So, okay, good morning, everyone. Approval of agenda. Is there anybody that wishes to add anything to the agenda? Okay, seeing. We'll go to that. Okay, all in favor as stated. Just circling back to attendance. I just want to talk to the clerk for a second. We have, obviously, Councillor Pierce is online. Have we heard from Mayor Davis or?
Through you, Mr. Chair, it is my understanding that Mayor Davis is attempting to zoom in, hopefully, and we do have regrets from Councillor Hunt. Okay,
thank you. Okay, so we'll move on. Anybody have a declaration of pecuniary interest? If you do, please, I'll ask that you make note of it at the appropriate time. We're going to go to item 5, delegations, petitions, presentations. Today, we have a special ceremony. Governor General's Emergency Medical Service Exemplary Service Medal recipients. And Russ, did you want to speak to this and what this is all about?
Through you, Mr. Chair, through our organization of OAPC and stuff, it recognizes paramedics from the very first for exemplary service at the 20-year, 30-year, and very few people get to a 40-year. I think there's only a handful of people that get their 50-year bar for contributing to the overall betterment of community and paramedicine in the province of Ontario. The Governor General's Award, and these awards are these 30-year, 40-year, and 50-year bars are handed out yearly in November at Queen's Park. And we also have our annual OAPC meeting, which is basically in September of every year, that paramedics that have gone above and beyond for their exemplary service will get their first 20-year service bar. Compared to the 5 people that we have here today, 2 are absent due to other commitments. We have about 175 years of experience in paramedicine across the county.
Thank you. It's good to hear. So how do we want to do this? Do we want to invite them up then? And okay, and I'll get you to come up. I'll get the mayor to give us a hand. Councillor Martin, can we borrow you to help hand out? Your steps. retired though, isn't he?
Vito's retired, he will not be here.
Yeah.
And Neil's.
I don't think you want to push that too far. There's wires under there.
So let's just break it up. We want to call them up individually first. Okay, so first off, we'll call up. Okay, we'll call up Russ. And Russ, I'm going to read it. Okay. So it says, "Dear Russ, on behalf of the County of Brant, the City of Brantford, and the Paramedic Services Committee, we would like to congratulate you on being awarded the Governor General's Emergency Medical Service Exemplary Service Medal." In how many years? 30-year bar. This award is a distinguished honor recognizing your outstanding commitment, dedication, and accomplishments over a remarkable career in emergency medical services. With more than 11,000 paramedics currently practicing across Ontario, you are among an extremely select group of professionals who have achieved this milestone. Your exemplary service and commitment to the highest standards of care set an inspiring example for all, demonstrating the essential role of paramedics in safeguarding the health and well-being of our communities. So congratulations on this extraordinary accomplishment. We are incredibly proud to celebrate your contributions and thank you for your continued dedication to excellence in emergency medical services. And this is signed by Mayor David Bailey, Mayor Kevin Davis, and Councillor Greg Martin. So, Thank you, Russ. And who's next? Okay. Yeah. Thank you, Russ. Michael, I'm not going to read it again, but I want to recognize the fact that, Michael, you've been doing this for a long time, 30 years, so congratulations.
Just like to point out, this entire 30 years.
What's that?
The entire 30 years.
It's been here? Okay, good. Yeah, David Dungy, and I think it needs to be pointed out that David has gained an exemplary service medal for his 40-year bar. So congratulations. Okay, and I just want to point out, not in attendance, but also receiving their awards, is Vito Torre, who is retired. I know Vito personally, and in recognition of Vito's services, he's getting the 30-year bar. And also not here today is Neil Vanderpost, and it should be pointed out that Neil is also getting his 30-year bar. So congratulations to those two gentlemen as well. And so we'll call up the recipients that are here today, and we'll get a group shot. Evan, you said? guys. Thanks, Cindy. Should be pointing out in 30 and 40 years, that's a lot of committee meetings as well. A lot of agendas. So. Thank you today. But thank you, gentlemen. Okay. We're going to keep plugging away because we got another meeting tonight, but we're going to 6.1, adoption of the minutes from the previous meeting. And that last one was on November 5th. Does anybody see any corrections or errors or things in there other than me? So I'm just going to bring up one then. I don't see Councillor Pierce raising his hand. Okay, so on page 4, item 5, this is for Briar. I want this to be fixed. Just stated that Councillor Miller requested updates on the new ambulance headquarters and not the hospital update. Okay, yeah, since it's relevant to this committee. So, yeah. Okay, other than that, no other further corrections on that. Okay, all in favor of the minutes? Unopposed. Thank you. Is there any business arising from those minutes? Things that we said we'd. Okay, seeing none. We'll go on to staff reports. There's 4, and unlike the city, we're going to go by them one at a time. So the first one is a construction update, and this is from Cindy. So can I get a mover just to get that on the floor, please? Councillor Martin, second by Councillor Pierce. Cindy, would you mind speaking to this report? It's the first one you did. I thought you did a bang-up job, a lot of good information there, but anything you want to highlight or point out?
Thank you. Good morning, and through the chair. So the report today before committee provides just some historical information on the process that led us to this point with the new lease arrangement with Grandbridge Energy and the construction status as to the current status of where the project is at. So as noted in the report, the leases were finalized, I think in August of last year, and we've been working in the background extensively with Grandbridge Energy, as well as the project manager, Collier's, the architect, as well as the construction manager to move things forward. Our phase 1 of the project did commence in November, and phase 1 is the administrative space for the new headquarters. Currently, construction for that is going well and is on target to be completed in July of this year. We're also working with the project team right now to finalize our phase 2 prices and award the tender for that. We have done quite a bit of work as well on that, just looking to ensure that as much as possible we can meet the initial financial estimates for the project. So we've made a couple of scope changes that won't affect the overall practicality or efficiency of phase 2. And we're looking to start that construction likely at the end of March. And the reason for that is that we were quoted quite a significant potential winter contingency fee for costs associated with construction in the winter. So that is our current target, to start phase 2 construction, and that construction is expected to last for approximately 16 months. The report also notes a bit of an increase right now for the phase 1 lease of, I think the difference was 26,000 overall total for that between the two. We are going to receive an updated lease cost estimate from Grandbridge along with the finalization of the phase 2 construction prices. So we'll have that information for committee at the next meeting.
Okay, thank you, Cindy. And we'll go to the committee for any questions, and we'll start with Councillor Pierce.
Thank you, Mr. Chair, through you, and yeah, I appreciate the report. I guess my only, and it's just a question, and I know it kind of states in there the rationale behind taking the contingency from 20% to 10%. Again, it's just a comment here, and I would, I'm not the professional, but I would prefer that we left it at the 20% and potentially came in under budget rather than take it down to 10% and all of a sudden go over budget. I'm just curious, was there, how that conversation went? I know it's kind of alluded to there that, the 10% is reasonable and we've got the pricing in. Like, are we really confident that 10% is going to do it? Because as I say, I would rather have it at the 20 and come in under than all of a sudden be over budget on this. Thoughts of that conversation, if I could, please.
Yeah, well, we'll go to Sydney for some. There's obviously things in the report that speaks to it. Is there things that, Sydney, you feel as far as background conversations? Can you speak to that?
Yeah, certainly. Through the chair to Councillor Pierce. So we had this conversation because I questioned it as well, and the phase 2, I guess, pricing did come in over the initial estimates. So there's sort of a twofold rationale here. One is that we need to use part of that 20% contingency to keep within the overall initial estimates for the project cost. Along with that, in speaking with the project manager, 20% is, to my understanding, a pretty big contingency for a project of this type and size. So the project manager, as well as the construction manager and Grandbridge, through those conversations, all felt pretty confident that we would not go beyond that 10% contingency in phase 2. Now, having said that, I do want to note that I did receive some information yesterday, because I do have a project meeting coming up tomorrow, that indicates there, like everything else right now, there is some concern about what these potential proposed tariffs from the US could mean for the project. That's all I really know right now. I'm sure we'll have a little bit more in-depth conversation about that when we have our meeting tomorrow.
Okay. As I say, it does say in the report there that that they're 10% is reasonable, stuff like that. But I just wanted to understand conversations that went on. So if these folks are saying that 10% is good, then I guess we'll have to go with that. I hope it stays within that. Thank you.
Any other questions for Sydney? Okay. Actually, that's it's a good question. I think Councillor Pierce raised a good issue, because there are a lot of unknowns at this time. But I guess as you guys go along, you'll keep updating us, and if we gotta bump it up, we'll have to bump it up. So it's something to keep an eye on, especially like Cindy mentioned, the tariffs. We don't know the impact of the tariffs. If the tariffs come, I don't think it's going to be a good thing, but we don't know the impact at this point. Couple questions from myself. The move-in date targeted for the paramedic service is 18 months, 16 months from today, approximately?
Yeah, through the chair to the chair committee. So there's a staggered move-in. Phase 1 is targeted to be done in July, and we're looking to move into the new administrative space hopefully in August of this year. Phase 2, which is the new garage space, that construction, we're looking to start that in March, and 16-month construction schedule that should be done in June of 2026 and moving in the summer of 2026.
Okay, so, and in the report you mentioned budgeting, we've budgeted lease payments to begin August of this year. Does that mean that provincial funds, we would see provincial funding coming to help with the lease payments in 2026, or would we have to wait till 2027?
Through the chair, so we budgeted for phase one portion of the lease to start in August of this year. So that's fully funded by the municipalities for this year. In 2026, we would receive 50% of that based on, what the current funding model is. So in 2026, we will be budgeting for that likely July lease start time for phase two. And the municipalities would have fully absorbed that in the first year.
Okay, and it wouldn't be till 2027 that we would get the full portion of the lease from the province. So, okay. Second question, phase two, that's the parking lot structure, commences late March 2025. Obviously, we couldn't do a groundbreaking for the offices because the building's there. Is there any talk of doing a photo op, groundbreaking, anything like that, or a ribbon cutting for the offices or anything like that? Is there any thoughts to that?
Through the chair, we haven't discussed it, but certainly if there is a desire to do that, I can have a discussion with Grambridge and see what their feelings are. And I agree. I had actually broached that a little bit with phase one, but it was awkward because there's already a structure standing there. So we did a media release in that case, but we could look at doing a groundbreaking for phase two.
Okay. I'm not going to make a motion or anything like that, but usually when you do a groundbreaking or a ribbon cutting, the mayors are involved. So I don't know if that's something you guys, is that anything? The reason I think it's not a bad idea simply is because it gets the word out, right? It's a communication to the public that, this is where some of your tax money's going. So, but I'll leave that discussion for Cindy, maybe in the mayor in their offices and their staff. And if it's something you guys want to go forward with, like I said, I think it's not a bad idea, but I'll leave it at that. Okay, go ahead, Greg.
Yeah, there was a time when we were having Aboriginal protests at construction sites, and a lot of that was precipitated by groundbreaking. My suggestion to companies at the time, and I think it's probably still a good idea, is not do a groundbreaking, but do a ribbon cutting when the facility is finished and ready to open. Mm-hmm. We haven't had protests in a while, but I don't see any need to start one with this because it being a project of importance to both municipalities and Grambridge as well, it might be a prime target for them to consider starting protests again. So my suggestion would be not to have a groundbreaking. Certainly do a ribbon cutting at the office space, and then another ribbon cutting when the garage is ready to open.
Okay.
And just further a question, once the garage is up and running and moved into, which stations will we be closing?
Through you, Mr. Chair, currently right now we're looking at our overall deployment plan. Nothing has been determined, but if you look at it, I would say 2 to 3 years down the road, Henry Street at 303 will no longer be there. 355 Henry will no longer be there as it's the lease space, and finding an alternative to Canesville as a community center moves on to other projects or sold in the future.
Okay, thank you, Mr. Chairman.
Okay, and I'll ask staff to keep your comments in consideration when they move forward. So, any other questions for Cindy or staff on this one? I don't see any hands, so I'm going to ask. Yes. Okay. All in favor of receiving the report? All opposed? Okay. We'll move on to 8.2. This is funding for paramedic services of paving and resurfacing of Brantford Fire Hall. This one was written by our treasurer, Heather. Can I get a mover for this one for $52,500? We'll move by Mayor Bailey, second by Councillor Pierce. Any questions for Heather on this report? Heather, I thought it was straightforward, so I won't ask you. Yeah, Councilor Pierce, you got your hand up. Please go ahead.
Thank you, Mr. Chair. Through you. I'm just, I was, to be honest, I was a little set aback by the price of this. You know, and I understand paving's not cheap, but I'm assuming that the amount of space that we use in that overall fire station, I don't know if somebody has that number, but I'm going to estimate, even if we said 25%, that would suggest that it would be over $200,000 to have that parking lot paved. I was shocked by the number. Is all I'm trying to say is you know the 52,500 is our portion. Can anybody tell me, you know, the agreement that was entered into, the amount of space that we're actually using in that fire hall? Like how do we get to that number?
Okay, so we'll ask Heather that question. So Heather, can you help us understand? Is this a prorated amount? Is this the whole amount? How do we get to this number?
Through the chair, it is based on square footage. That's per the agreement. I'll have to go back and I'll look into the agreement itself to see the actual number of square footage overall, and then I can reply.
Yep.
Sorry.
Go ahead, Councilor Pierce.
Yeah, thank you, Mr. Chair. Yeah, just to follow up. And again, like I say, and I totally understand that absolutely we're using part of the facility. We should absolutely pay a share of it. But I was just, as I say, I was really set aback by that because you know, if you look at that site, yes, it's a fair amount of asphalt, but again, I don't know how much space we use of it, but I'm just hypothetically saying if we use 25% of it, that would suggest it's over $200,000 to pave that. So I'm just, if we can find that out, if that is our, you know, square footage share, then it is what it is. But again, I would like more information, I think is what I'm trying to say, Mr. Chair. Thank you.
Okay, and I appreciate the question. We don't have that information today, but
yep,
we have a guarantee from Heather that we will get it as soon as she can.
Awesome, thank you.
Any other questions? Okay, seeing none. We will call the vote, knowing that we don't have quite all the information, but we will get it. But we'll call the vote on that one. All in favor? Opposed? That's carried. We're going to go to item 8.3. This is the Paramedics Services Statistical Package. And Russ, this is your report. So I'm going to ask if we could get a motion to get this on the floor. Moved by Councillor Martin, seconded by Councillor Pierce. We'll go to you, Russ, if there's anything you want to highlight or talk about in this report before we turn over for questions.
Through you, Mr. Chair, the report is as written. I've got a prepared statement for the overall service update that incorporates a lot of these questions or a lot of the good news stories. If you'd like me to proceed that way first, and then we can go back and ask some questions, it's up to you as a committee chair.
Yeah, let's do that, Russ. Let's do the update because in that update it actually might answer some of my questions. So yeah.
Okay, please. Through you, Mr. Chair, I've got a couple page update. So first of all, everything that we're going to provide you right now is actually good news trending in the right way. First of all, I'd like to start with our CP. Our CP program is now been asked to present at the Community Paramedic Council Knowledge Exchange in Toronto in the month of February. Their topic that they're going to be presenting on is Motel Outreach Program. The community paramedics work within the city housing and the bylaw to help those in the motel program find more stable housing, social supports, and overall medical care. At the end of my presentation, or at the end of your questioning, I brought Deputy Chief Glenn Kinane up to answer any questions regarding that or anything dealing with the CP program. He actually just most recently met with the VP at the Brantford General Hospital and the ER director on how they can work out and work within the emergency department to help people get better connection to the community services within the community. Next, we have one of our many vehicles that we ordered back in 2023 arriving at the end of January. The other 3 vehicles for 2024 that we ordered in 2023 is late to mid-January. Hospital staffing and offload improvements. So working with the hospital and their goal to improve our overall offload delays, they've had additional nursing hours secured. We've worked with the ministry and the BGH, so we have our full funding till March 31st. Besides the back hallway nurse and the zone 2 nurse, the additional funds, because of our program started a little bit slow in April of this year, if they need the capacity, additional nursing staff will be covered by the existing program. BGH enhancement, they've hired 13 nurses, 2 brand new clerks. They were short staff. They have 4 additional pending nursing positions, which I believe have already been filled. This was as of the mid-December. For our service, as of 2025, what we're looking forward to is a medical priority dispatch system, MPDS. We are finally scheduled till 2025. This system will enhance call triaging, ensure optimal resources allocation, and improving response times and patient care. We're also going to be launching our iPad program to support that. We just launched the iPad narcotic tracking system, so we'd have more accuracy over the narcotics that we do carry and make sure that we're met with the overall Narcotics Act. We now have just implemented a brand new cell phone information system. Most of our crews don't get information on what's going on the road on a daily basis. Now our superintendents get an opportunity to basically text the entire group that's on the road that day on offload delays, road closures, and other things happening, so they're more informed. We've also looked at our overall key metrics for 2024. In 2024, our call volume was 34,406. In 2023, it was 32,114. So on average, our call volume has increased by about 5 to 7%, and the hospital is noticing the same. On average, we were taking in about 32 patients a day. Now we're averaging 37. With that extra 5 times 30 days, that's a minimum of 150 patients. And the patients from the meeting I just had with the ministry this morning, our patients are sicker. There's more C-Task-1 patients going into the ER. We don't know why that is, but it is increasing. We also measure our overall utilization of vehicles. It's a new concept. It's a concept that's been around for a while, but we gauge that right now, in January of 2024, our UHU that we monitor was 0.52. At the end of December, it was 0.34. Anything that is below 4.2 or less, we are utilizing and maximizing our resources to be prepared for blips in the system, right? So all the input, extra vehicles that you provided us have really made a big difference. Here are the key operational improvements as you were going to ask. So the lost hours in emergency decreased by 85%. Our highest was 1,200 hours. Now we're down to approximately 230 hours per month. Our code zeros have reduced by 73%. Our high was 220, and now we're under about 80 per month. Average emergency time on a call has dropped 75%, averaging 2 hours and 30 minutes to around 60 minutes. External use of EMS or other EMS services have dropped by 25%. And another metrics that we do for dealing with the crews and their morale and getting them downtime is our highest meal claims were $9,340 a month. They have decreased by 73.6%, down to an average of $24.50. These figures were as of November 30th and into December. In January, we've noticed a blip. That's because of cold and flu season, but the BGH is still managing things that get our crews back on the road, limiting the amount of code zeros. So looking ahead for 2025, with this ongoing support of the Ministry of Health, our service is committed to sustaining and building upon the improvements, continued collaboration with the BGH and other stakeholders, with this to be critical in achieving their goals. We'd like to thank everybody, including our paramedics, for the ongoing support. This council that's dedicated to improving our service. Together, we've made remarkable strides in 2024, and we look forward to the improvements and continuing on with our success for 2025.
Okay, thank you, Russ. It's good to see the trends going in the right way. Mind you, we never seem to get there, but we're always running, so we don't have to run quite as fast to stay in place. So, any questions for Russ on the report or his update? And we'll go to Councillor Pierce first. Go ahead.
Thank you, Mr. Chair. Through you, A couple, Russ, if I could. First of all, thank you for that report. It did answer a couple of questions, but a few I have here. So great news that we've finally received one of our new ambulances, and if I heard correctly, the other three will be by the end of the month. That's the plan. So that'll give us 4 new out of the 8.5 that we have deployed. Can you give me an idea, if you know, Russ? So we'll call it the 4.5 remaining of the we'll call them the on-duty ambulances. How old are they? Are they the ones within the last few years? I'm just trying to get an understanding of our fleet that's out on the road now. Should be, once we get these other 3, so adding 4 new into it, that they should be fairly new. Is that a fair statement?
Through you, Mr. Chair, just to clarify, we are funded for 8.5 24-hour ambulances.
Yeah.
Not just 8 ambulances running. We basically have 10 during the daytime. We've split up the hours to maximize the call volume, and then we're down to approximately about 7 or 8 at night. So
Yeah.
right now we have a fleet of approximately 17 ambulances. What we've done currently right now is our original cycle was supposed to be replaced in 5 years. Some are at 6 and some are at 7. The ones we plan on replacing in 2024 are the vehicles that are 7 years of age and pushing over 300,000 kilometers.
Okay. So that we still got some that are 6 years old, but the most of them now are like the 8.5 we have on for 24 hours, and the total of 17. We're getting ourselves in a decent spot. Is where I'm going. Is that fair?
Through you, Mr. Chair, that is correct. We're about 18 months behind being healthy, and it's all because of supply chain. Council has approved us changing the ambulances, the money, the funding. We're just chasing because of supply chain and the back order.
Right. No, I appreciate it. Okay, good. And as I say, great news on getting at least the 1 and then the 3 more by the end of the month. That's fine. On page 8, when it comes to our benchmarks, and if we look at sudden cardiac arrest, it seems that we're having a little bit of trouble hitting that 60% since we changed it to that. Is there anything standing out that we can rationalize that to, or we're just trying to get ourselves in the spot where we can hit that?
Through you, Mr. Chair, we're actually improving from 2022. Our improvement, we're going up about 10% a year, right? We have made minor changes in the overall response back to cardiac arrest. We're at 55. Our goal for this year is to exceed past our benchmark of 60%. In previous years, our benchmark was only 30. So we've increased our finish line is farther out, and we're still coming close to trying to meet that goal of 60%.
Okay, so there's nothing glaring that's holding us back. It's just we're continuing to work towards it. Correct?
Correct.
Okay, cool. All right, last one, if I could, on page 9, when we talk about code zeros, absolutely. If we look last year, we were in the 200s for a couple of months. September was 186, and then we took a nice dip down, which was great to see. But I'm seeing a little bit of creep, and I think in your report you were saying we're down to about 80, and December was 88. I'm curious here. Are we looking at a little creep back up again, or is it just was it just a fact of November, December, potentially more people calling for the cold flu type thing? I'm not sure. It's way better than we were over 200, 186, but I'm just trying to get an understanding of I'm seeing a little bit of creep here. Am I just seeing things, or is that legit?
Through you, Mr. Chair, you are seeing a bump. When it comes down to the holiday season, the last 2 weeks of December, a lot of the doctor's offices closed and stuff, which causes more of a call increase for us and more demand in our system. From the meeting I left with the hospital at 10 o'clock this morning in the ministry, they've noticed an increase as well for our overall call volume that we're bringing patients into the hospital, but it's more dealing with the cold and flu season. We haven't been hit through October, November. December started to peak, and January right now is the worst. So we are going to see an increase. I've looked at the overall trend over the last 4 months in the ministry and the hospital and us working together. And if you look at from September at 186, October, November, December, they're still putting the appropriate things in place. And I get notifications of every time we get into normal status, status 2, which is less than 2 ambulances, or 0. The times between the 2 and 0 are a lot shorter. rather than seeing 45 minutes to an hour that we have no vehicles. The hospital, when they see that status 2 and especially a status 0, they jump on it and try to get us beds as much as possible. The meeting I left this morning, they had 32 admits to no bed as of 10 o'clock this morning. And that's what they're dealing with on top of our call volume and the cold. But our crews are doing a good job maintaining it, and our offload delays have changed.
Right, as they always do, Russ. And again, thanks for all you guys do. One final comment. That's fantastic that we were continuing the funding for the dedicated offload nurse, because we've seen that is absolutely helping. So I'm glad the province is seeing that as well and continuing to do that funding. Thank you very much.
Thank you.
Okay, any other questions for Russ? Councilor Martin, go ahead.
Yeah, the defibrillator on scene within 6 minutes. Do you include the fire department in that? Like if they get there in 5.5 minutes, does that count as reaching that goal of a defibrillator on scene?
Through you, Mr. Chair, the 6 minutes is from the first time that somebody has a defibrillator at the side. It could something happen to this council chamber, Cindy went and got it. That's where the clock stops, right? When our crews do, they do document on what time the defibrillator was there, and we do take into consideration the ones from the fire department, from the county and city as well.
Okay, so if it's in an arena and there's one in the arena and somebody grabs that counts as well then?
Through you, Mr. Chair, as long as the person grabbed it and started, that's where we take the 6 minutes or less.
Okay, thank you.
Any other questions? Seeing none, I wanted to ask you, did you say there was 32 no beds this morning?
32 admits to no bed.
That's, you inspire me, Russ, every time you give your report to stay in good health, I'll tell you, because.
Through you, Mr. Chair, that hospital is doing the best that they can in trying to get the patients out right. They've worked, like, even not giving out too much information, even other departments are stepping up when they see the overflow and emerge, like diagnostic imaging or fracture clinic or whatever. If they can take some of the beds, the hospital, the team right now is committed to get us out back on the road and providing the best care within our community. So the group that Bonnie and her team have put together right now is a team that's actually working well.
No, I think everybody around the table understands the challenges they face, but when you hear it, it's always a little bit, it makes it real, you know? So, I want to ask, the numbers we have here today, it's good to see they're going forward. They're going in a good trend. And that delivery model, like you're going to study, there's a study you're doing this year to look at how dispatch works?
Through you, Mr. Chair, the new MPDS system, we have to start building our deployment plan when the new system goes out, right, for the overall improvement of calls, utilization of resources as well.
And when will that happen?
We're set to launch. We're doing the educational portions right now. It's like once every 2 weeks. There's a tutorial on the next steps and what work we have to do, but we're hoping to get launched by November of 2025.
Okay. And I'll just share, a few of us went to Roma there this past couple days, and we heard a presentation from the Renfrew chief of their paramedic services, and they talked about how in 2023, Renfrew, which I always thought was well, it is. It's a beautiful area of the province, but population around 20,000. They had 41 deaths from overdoses in 2023. In their paramedic services, they took the lead on that, and they worked really closely with their social services, and they come up with a program. They call it MESA, M-E-S-A. It doesn't stand for anything. I'm not sure where the name comes from, but so it's. I guess when you guys do this, when you meet with other ones, but there's a lot of different programs, I guess, paramedic services are engaging in. We have some here that we're doing, and others are doing other things. So that's something you guys will look at on a regular basis, best practices throughout the county, or throughout the province, sorry.
Through you, Mr. Chair, when the hospital, these programs, and in the community paramedic program, the ministry says here, create a community paramedic program. There is no cookie cutter. There is no template of what we use, right? Glenn and his team have basically fit a puzzle like into the community, what works best from palliative and long-term care and the community outreach programs. Like they're speaking on behalf of the motel project. Glenn and his team just met with the VP Stewart at the Brantford General Hospital, right? How good they can insert themselves into the ER department, right, to betterment of the community and the people that would be discharged to, say, no residence or no home, or get them the appropriate care. So we're always coming up with new innovative ideas, which is good. The ministry allows us to do it within our current practice. We're trying to look out for the community first, and then I guess deal with the budgeting funding within our aspects. Like Glenn right now, he's here with us. If you have any questions regarding the community paramedic program or their new initiatives that they're trying to launch, he is a great resource just for overall community information.
Okay. Yeah. Yeah, I'm just throwing that out there because the change is constant, right? And we're always trying to get better. So to the committee members, obviously to you guys, if you see things, bring it here, and we'd love to look at it, talk about it, and all that. Because I know there's a lot of things out there that we could maybe are worth looking into. So, and I'm sure Glenn knows that as well. So, we're going to go to Councillor Pierce. He's got his hand up again. So go ahead, Councillor.
Yeah. Thank you, Mr. Chair. And it brought a question when we just reiterated the 32 no beds there. I'm curious, and I know with the county and I know with the city, they've got fantastic communication departments and stuff like that. And I'm not sure if the hospital does or anything like that, but I'm wondering, is there anything out there that goes out to the public to say, not stay away from the hospital, but, go to your doctor or other possibilities and stuff like that? Because I don't know, I'm not there, but I'm assuming, as you've alluded to, Russ, with the cold and flu, I've got a pretty good one here myself, that people are going to the hospital for that sort of thing and then sitting in rooms and waiting type thing. Is there any sort of, I'll call it public education that we as the county, and I'm going to say we as the county and the city's communication departments, and maybe, work with the hospital department to put broadcasts out? Is that something that we do or has been talked about or thought about or anything like that, just to try and alleviate some people that maybe legitimately don't know that, hey, this is an issue we have. We're in a situation right now. We've got 32 people, waiting to be admitted, no beds type thing. Is there any discussion around that type of thing, Russ?
Through you, Mr. Chair, and the previous management team at the BGH, and through our communications department of the county, right? We've set out broadcasts not to not go through the hospital, right, but to basically find other alternatives, use urgent care. We have not done anything like that this year. But what we're seeing right now, even with the patients going on there, they are sicker than sick. Like, seeing the increase in CTAS funds, in layman's terms, be lights and sirens coming back each and every time, right? That increase, that's how people are waiting at home longer. Or is it because they don't want to go to the hospital? Is it because they don't have a family physician, right? They are just sicker coming in, right? And that's what our crews is seeing, and that's what the ER department's seeing at the same time. But we have done the communications in the past, and I will work with Cindy in the communications department and contact the hospital to see what we can do again for this year, and maybe put in the calendar for every October, November, that there's some type of communications going out to the public as a general reminder.
Yeah, and just a quick follow up, and yeah, I want to make it clear, I'm not saying don't go to the hospital, but as you said there, there's other options and stuff like that, right? But no, I appreciate that, and like I say, I know with the county, and I'm sure the city and stuff like that, with the communications departments to get that word out to any and all of those that'll actually look at it type thing, but just some of them might legitimately not know the other options, right? So thank you for that.
Thank you.
Okay, any other questions? See none, I'll call the vote to receive the report as moved. All in favor? Okay, thank you. It's passed. Okay, we're going to talk about the meeting schedule. As you know, we like to meet every other month. So, Brian, do you want to speak to the suggested? Does everybody have that sheet? You pass it around, except for Councillor Pierce.
I will. I'll share my screen.
I got the one from our agenda, Mr. Chair.
Through you, Mr. Chair, I just printed off an amended copy here for the committee here, Councillor Pierce, but I'll share my screen so you can also see it.
Thank you.
Okay, so just in some further conversations with staff, we're proposing to change the first meeting date because of the counties, and there should be no further conflicts there. The second to May 21st and July 16th is as presented. There's an additional meeting, a budgetary meeting for September 10th that I've put in there. And then just noting that September 17th would be just as required for the second budget meeting. Any other questions? That is the amended.
Yeah, and that budget, may not be required. We required it, I think, the year before because we weren't able to get through the budget for that other meeting. Thoughts, comments, concerns?
Works for me, so moved.
Okay, Councilor Martin, you're okay.
Yeah, I'll second that. Actually, the March meeting change is good for me because I wasn't available the week before. I'll be on vacation.
Okay, perfect. Yeah,
All for you.
Yeah, and it is a little tricky, trying to balance the county schedule with the Brantford one. So, okay, so it's moved to second. I don't see any comments. So, all in favor of that one? Okay, so moved. And again, if something comes up and we have to have an emergency meeting, there's always up to call of the chair as well. So. So that is the Paramedic Services Committee meeting schedule. 8-4 communications. We don't have any other business. I didn't see anyone's hands up. Still don't see anyone's hands up. So that will take us. We do have an in-camera item today to move in camera. So moved by Mayor Bailey, seconded by Councilor Martin. All in favor of going in camera?
Sorry for you, Mr. Chair. In camera to discuss section 239.2 D labor relations or employee negotiations RPT 0031-25 collective bargaining update. C. Stevenson.
And that goes to the motion as moved. Okay, thank you, and I appreciate us. We always have to say that. Okay, so next meeting, in our agenda package says March 19th. We've changed that. We had to change that to March 26th. So just make sure you make a note of that for your own personal use, but the clerk will let us know. So other than that, that concludes our business for today. So I will call this meeting adjourned.